where refugees get insurance. I just want to be able to give people kind of a comprehensive look at what it is kind of from the time that refugees arrive to the U.S. And then we're going to, of course, the meat of the presentation is going to be about post-RMA. Kind of what insurance plans people will go on to, kind of this idea of the mandate. We're going to talk some specifics about marketplace insurance and how clients can enroll and who and when and how they do that. But then also we're going to talk about Medicaid. So a large majority of our clients will actually just stay on Medicaid following refugee medical assistance. We're going to touch on some of the things now with Medicaid expansion on the horizon, and maybe the, in general, just kind of the future, what we can look forward to in 2015 and then following years. Okay. Okay, so refugee medical assistance. So as everyone knows, refugee medical assistance is the special health insurance plan for refugees. It lasts 8 months from arrival. It's some of the big questions that we're going to talk about in this presentation are kind of what happens afterwards. And a lot of times, as you'll come to learn in this presentation, is that some of these options are kind of left out, and if we don't follow clients through the process, then there can be a gap. I do want to go with the main takeaways. I accidentally skipped this slide. The main takeaways from the presentation, if you only look at one slide through this whole presentation, you should look at this one. And that is no refugees or asylees starting in 2015, should ever be uninsured. You know, there are options available now with Medicaid expansion that they should they should not be insured because A, there is coverage available for them, and then B, there could also be financial penalties if they don't pursue insurance. And so that's the next thing. If they don't apply post-RMA, they have 60 days. If they don't find some sort of insurance, then they can be penalized. And then, of course, the last takeaway is to kind of watch out. There's a lot of changes right now that could happen, especially with the election coming up, on Medicaid expansion, and then on refugee medical assistance in general. So this is just a warning just to keep an eye out and kind of keep in touch with kind of what's happening in the news, because that will have a direct impact on our clients. So like I said, refugee medical assistance goes on for 8 months. What that looks like is, for anyone who's on the provider side listening to this presentation, you'll be familiar with this. For the first month, they have the access card. You know, this is called PAMA, fee for service. They just use the access card for the first month that they arrived. And then they move on to this HMO. So this is kind of what the welfare office calls health choices. They can choose between Keystone First or United Healthcare or Aetna, Better Health. And that's what they have for the remainder of the months. This is actually pretty good insurance. From what I've experienced, it has pretty good medical coverage. There is some variance between the different HMOs, but overall it's pretty good on the medical side. Surgeries are covered. There's very limited copays, and of course a great benefit to our clients is that there are no premiums, which is a big thing. But there is a negative side. There is limited dental and vision, and we've been having problems with that as well. So now post-RMA. So this is kind of where I really want to focus this whole presentation on. So this is, I think talking about post-RMA is extremely important because this is the insurance that refugees and the clients we work with will have for the majority of their life, especially years to come. You know, RMA is such a small part. It's only the first 8 months from when they arrive. But what they are connected to after RMA is extremely important, and they will probably go years and years with this type of insurance. So that's important for making sure that they are receiving the benefits they can, but also for like understanding the plans that they have and kind of understanding kind of how those things can change. I want to touch on briefly immigrant eligibility. So this presentation is mainly focused on refugees. But I just want to mention that because of that, refugees and qualified immigrants are eligible for Medicaid. Now, this is not true for most immigrants who arrive. You know, there's the thing, the 5-year ban, where most immigrants are not eligible for public benefits for the first 5 years they are here. But we're going to talk about that just briefly later on when we talk about insurance in the marketplace and kind of the options that are available to them. And then also, of course, this definitely does not apply, sadly, to undocumented immigrants because there are very limited options available for them. Like I said, refugees are qualified immigrants, which makes them eligible for Medicaid and public benefits upon arrival. That's also true for asylees. Once they are granted asylum status, they are eligible for public benefits. And there are a couple other categories if you guys are interested, but we're just going to skip over that because it's mainly about refugees. So the big thing to take away about post-RMA is this idea of the mandate. So the mandate is a big part of the Affordable Care Act, probably arguably one of the biggest parts. And it started in 2014, basically said that most people in the United States, that's refugees, that's citizens, most people are required to have insurance. This is huge. But now some clients will be exempt from that mandate, but most won't. And if they do not get insurance, then they will receive a penalty. Now, what does that penalty look like? If they do not get insurance and they are eligible for that type of insurance, they can get fined, and that fine comes during tax time. So when clients go to file their taxes, if they didn't sign up for insurance when they were eligible, then they will get hit with, if it happened in 2014, a penalty of $95 per adult, or 1% of family income, whichever is greater. And usually it's the 1% that is greater. You know, if we have a client who makes $27,000, you know, 1% of that is going to be more around like $270, and that's definitely more than $95 per adult. But then, of course, this penalty gets bigger and bigger. You know, the U.S. government is trying to incentivize people getting on plans. So in 2015, this year, if clients do not apply for insurance this year, the penalty is going to be $325 per adult, or 2% of family income. Yeah, and I think the bottom line here is that this happens at tax time. So clients aren't necessarily aware of this penalty until they've already not applied for insurance. So clients who were supposed to get insurance this past year, if they didn't, they're not going to know about it until they do their taxes this April. But there are some, now that I've scared you, there are a lot of exemptions from the penalty. So if you are below 100% of the federal poverty line, which most of our clients are, you actually won't get penalized. That's a really great part of the Affordable Care Act. If you're undocumented, clearly you don't file taxes, you're not going to get it. And then there's this interesting point where if the insurance that is available to you is more than 8% of your income, then you are exempt from a penalty. And this actually happens a lot with some of our clients who are single males and are kind of like working a million hours, and they make a lot of money, but however the insurance, the job that they work does not provide insurance. Because of that, they are forced into the marketplace, and the marketplace plans can get kind of expensive if you make a lot of income and can actually go over this 8% of income. So that's something to watch for, especially when clients are making a lot more money than normally our clients do. So yeah, but most clients, I mean, this year now with Medicaid expansion coming up in 2015, all refugees and asylees will have an option for insurance. So we shouldn't even be talking about penalties. We shouldn't even be talking about exemptions. There should be an option for everyone. I want to focus on the Medicaid part because that is something new this year for all of you who participated in 2014. There was a gap, so a lot of clients fell into this gap where they were not provided insurance. We'll talk a little bit more about that later, but I just want to point out that now Medicaid is expanded for 2015, so anyone under 138% of the federal poverty line will be eligible for Medicaid. So that's pretty good. And then everyone over will be eligible for insurance through the marketplace. And of course, when we talk about the Affordable Care Act, and when we talk about Medicaid, we're always talking about this idea of the federal poverty line and these MAGI rules. It's kind of complicated, but it's less complicated than you think. I always have case managers who are coming to me and asking me, oh, I have this client, I'm not sure if he's eligible, can you do the calculations for me? It's actually not that difficult. So federal poverty line is based on income, and tax household size, and based on these idea of magi rules. What that means is you can just think of it kind of whatever the federal government thinks about household size in regards to tax household size and tax income. So we have a lot of, from a refugee perspective, we have a lot of Bhutanese clients who live with their parents, their grandparents, their kids, their grown-up kids, their grandkids. There's these really huge household size. So sometimes that doesn't translate. And when working with these clients, it's important when determining the federal poverty line for them that you are actually counting household size from a tax perspective. So that does not include grandparents. That really only includes spouses and then kids who are under the age of 21 is usually what it is. Once they become adult children, that's when they kind of usually start filing their own taxes. And then from an income perspective, there are some important things that are exempt. So even though Social Security is not exempt, SSI benefits, so supplemental security income, is exempt from this. So if you have clients, and this is specifically refugee clients who are over 65, those SSI benefits are not counted. And then, of course, clients who are under 65 who have some sort of chronic disability that allows them to get SSI benefits, that income is not counted. Now, we don't really need to worry about those clients because they'll go on Medicaid, and we'll talk a little bit about that later. But in regards to tax household size, if you have I have a client who has a child with cerebral palsy who gets SSI benefits. Those parents will not count the child's SSI benefits in when calculating the federal poverty line. Workers' comp, usually our clients, we don't really see workers' comp a lot. Children's income, so if it is, we have a family and they have a 19-year-old son who has a job, we do not count children's income in that. With all that said, once you can calculate this income size, then you just take the income from the family members who are actually counted in the tax household size, and you can calculate how much they'll make per year. If there are 2 workers in the household, then you just add it together. It's very simple. And now it's a lot more simple in 2015 because we don't need to calculate this gap. We can now just calculate yearly income, and we can look at this one line, and that line is 138% of the federal poverty line. If I were you, I would jump it to 140 just to be safe. There are a lot of things that it's a lot of deductions that they can take away that kind of like fudge the numbers. Yeah, so this line that you see on the right, this is the income limit. So if anyone, if you look at this slide, if any clients fall under this income, which is a large majority of our clients, then they will go on to Medicaid. And this is kind of a nice graph kind of showing that anyone under 138% will get Medicaid, and over 130% will get a marketplace plan. There should be no one who falls into a gap now because of this. Everyone should have it. Now, one quick caveat about employer insurance. Most Americans get insurance through their employer, and that's something that we actually don't see in our refugee populations. Many of the jobs that they work, of course, are temp jobs. They work in meat packing factories and things, and places where the company does not provide insurance. So most of the time, clients with working job will go onto a marketplace plan, or if they make too little income, they'll go onto a Medicaid plan. But occasionally, we do have clients who work full-time at Walmart. They work 40 hours at Walmart, and they do get Walmart insurance. But that, if they're eligible for Walmart insurance, but they're under 138% of the federal poverty line, then yes, they can still get on Medicaid. But if they're over 138% of the federal poverty line and they work at Walmart, they actually have to go with Walmart's insurance. And we'll talk about that a little bit more in a second. So now I want to talk about kind of the differences between the two, right? So once refugees finish this 8 months, they can go one of 2 ways, right? And if they're over 130%, which you guys are great at calculating now that we've kind of talked about this, you can say, oh, well, you're actually going to go onto a marketplace plan. The marketplace insurance, hold on one second. Marketplace insurance plans, or as a lot of our clients call it, Obamacare, they're actually just private health plans. But you purchase it through the health insurance marketplace. And this can be pretty confusing for our clients when it comes to kind of Who do I send mail to? Oh, I received a letter from my insurance company. Oh, I received an insurance letter from the health insurance marketplace. So very simply, clients either call or go online, and then they apply for insurance at the health insurance marketplace. It's a website, but it's also a phone line, and then from there you can sign up for either an Independence Blue Cross plan or an Aetna plan. And that can get kind of tricky, but it's normally pretty easy. There was a lot of bumps in the beginning, but now it's going pretty well, and a lot of times it can be very straightforward and very easy to do. Also, consumers, these are pay plans. Consumers will receive help paying for these insurance plans if they're under 400% of the federal poverty line or over 138% of the federal poverty line, which makes sense, right? Because if they're under 138% of the federal poverty line, they'll be on Medicaid. So just to talk a little bit about kind of cost. So this is something that's really new to our clients. They've been here for 8 months. They've been on Medicaid. They've got the Medicaid figured out. It's pretty easy. They don't have any co-pays. They don't have any premiums. They've just gotten used to paying their PGW bill. They've been working on a job now. Everything's getting settled down. And now we're telling them, oh, just kidding, insurance is something that you have to pay for. And so you get this look sometimes when you tell them that not only do they have to pay a premium each month, but then you also have to pay co-pays. And that can be kind of frustrating for our clients. But a lot of times they do get help paying for these plans. And that's help paying for co-pays and help paying for premiums. So the premium tax credit, which is 100 to 400% of the federal poverty line, that's what helps them pay for the monthly premium. I have never, in my entire application history in the past 2 years, had a client who did not receive a premium tax credit. Barely, 400% of the federal poverty line is huge. I don't even think that I'm over 400% of the federal poverty line. And so a lot of our clients will get these premium tax credits. And what that looks like is you can have clients who are at 100% of the federal poverty line, and they can get an insurance plan for 25 cents. But it's based on income. So if you have a client who's at 200% of the federal poverty line, their insurance plan per month will be a lot more expensive. And it can get kind of confusing when you're speaking with clients. Specifically, they get really concerned that their tax return is going to somehow get deducted. Maybe you have a client and they come in and they're like, I got this letter. It's saying that my tax credit, should I use it now or should I get it back at the end of the year? And it can be very confusing. But basically, the U.S. government gives additional tax money for you to spend on premiums, and you can use that upfront in order to pay for your plan. And then there's also these cost-sharing reductions. This is mainly, you can just read this as help paying for co-pays. It's only for 100 to 250% of the federal poverty line. So we do have a lot of clients who are over that and don't get help with cost-sharing reductions. They do. You can see it's usually. Without a cost-sharing reduction, you'll have a copay of like $15 for a primary care visit, but with it, it'll shut it down to more like $5. So that's pretty good. That's pretty a good thing, and I think a lot of our clients are kind of okay with a $5 copay, but a $15 copay gets to be a lot. And again, these are all calculated by MAGI rules. Again, so this is just an overview. Advanced premium tax credits, they're the ones that help you pay for the premiums, and they do use them in advance so that each month it can help you pay. And this is reconciled at tax return, and this is something that is also really confusing for clients, and if you are helping clients in any way with insurance, whether you're a VOLAG or you're from a community-based organization, it's important to note that this is not something that you can rely on. So a lot of I have had one client come in and I was like, well, how much do you make? And he was like, well, how much should I make? And I was like, no, that's not how it works. So it is reconciled in the annual tax return. So when they do their taxes at the end of the year, they will look back at what they said they made when they were filling out a marketplace application. And if they made more, then they will charge them some extra money because they were giving them these advanced premium tax credits to pay for their insurance. But if they make less, they'll actually get money back. So with this said, it's always better when you're calculating income for clients. If you're going to always have clients who are like, oh, I'm working 30 hours some days, but other days I'm working 40 hours a week, it's always better to say that they work more hours. Sure, their premium per month will be more by a small amount, but they will get that money back at the end of the year. It is reconciled. And that way they don't have to pay extra if they did miscalculate. So moving on, this is the part that I really think will be a great takeaway for all of you who are working directly with refugees. And this is kind of demographic of who is going to get these marketplace plans. So if you work with single Sudanese men or Eritrean men, they are almost always eligible for marketplace plans. They have a job, they have no kids, they have no wife, and a lot of times they're around 200% of the federal poverty line. They like to work a lot. These are the clients, and then at the same time, there are not a lot of there's not a lot of community structure there. So it's always scary to me because these are the clients that can easily kind of fall off the map and then eventually get penalized because they did not get insurance. 20-somethings are also people to look out for with these marketplace plans. These are a lot of times we get these big families, and they have kids who are like 25, 26. Most of the time, if you grew up in the U.S. like me, you would have your parents help pay for your insurance until you're like 25. But for a lot of these kids, they don't have that. They don't have their parents don't have employer-based insurance, and so they would actually have to go onto the marketplace if they did have a job and were eligible. Couples with a single worker and 0 to 1 children. So maybe they just had their first baby, or maybe they haven't had a child yet. They're probably eligible for the marketplace. And then families with additional income. So we see this a lot with Bhutanese families who have caregiver income coming in. So say they live with their parents. Through PCA and Medicaid waiver programs, they actually get money someone in their household gets money to take care of their grandparents. So that money is actually counted, and if usually most of the time the wife is taking care of the parents and the husband goes to work every day, then that's double income. And a lot of that times that will push clients above 138% of the federal poverty line, and then they will be eligible for marketplace plans. And then, of course, if you just have 2 workers in the family, a lot of times that pushes them over. And then the last thing is asylum seekers. And I'm actually I have a whole slide about asylum seekers because I think it's really, really fascinating. When the Affordable Care Act passed, and many of you will know this, Medicaid was supposed to be expanded, but the policy wanted to have room for immigrants who were not eligible for Medicaid due to immigration status. So this is this 5-year ban where immigrants who come to the U.S., they can't get public benefits for the first 5 years. So these clients, the policy, the Affordable Care Act said, okay, these clients can enroll in marketplace plans even if they're under 100% of the federal poverty line. And that's huge, because it works for even 0% of the federal poverty line. And in regards to kind of working with clients like asylum seekers who are waiting to hear back about asylum, that can be huge because they can come, they're waiting for their asylum application to go through, and they can actually apply for insurance, even if they don't have a job. Because it can be really, really difficult to get a job. And that's triggered by kind of all of these things are triggered by work authorization. So when clients get work authorization, they can then have 60 days to go and apply for marketplace insurance. And it works for even clients who don't have jobs, and that's really great. So unemployed, and that's one of the only places in the past year where clients with really low income can get Medicaid. And then it causes all these interesting policy implications where you have states like Texas, where you have native Texans who can't get any, they're unemployed and they can't get any insurance, but their neighbors who are just immigrated to the U.S. and don't have a job, they get insurance right away for like 25 cents. And that's a really interesting thing that's happening because of that policy. But the last thing I want to mention is that they do need to file taxes. That's extremely important, even if they don't have a job. when to enroll. So now that we talked about who is enrolled, when to do it. So the open enrollment period, anyone can enroll, and that's between November 15th and February 15th every year. Clients can change their plans. They can sign up for new plans. This is when our biggest community pushes go out. This is the time where everyone's got a clean slate and everyone can come and apply. But then, of course, there are these special enrollment periods, and this is the most, I think, the most applicable to our refugee clientele. A lot of times they're arriving, throughout the year, and they will end their 8 months at random points throughout the time. They're not going to end their 8 months necessarily between November 15th and February 15th. So what they trigger are special enrollment periods. And now these are kind of 60 days following qualifying life events in which clients can go and enroll in marketplace insurance. If they didn't have the special enrollment period, then they would have to wait until open enrollment. Now, some of these qualifying life events are losing insurance, which is going to be for most of our clients losing RMA, and then, of course, moving states, gaining eligible immigration status, or change in family size. Now, the thing I want to emphasize most is that most refugees eligible for marketplace plans will trigger a special enrollment period at the end of their 8 months, and they will only have 60 days to enroll in a plan, or they will be penalized. Now, thinking about refugee resettlement, we get our largest numbers in July, August, and September, right before the fiscal year ends. Those clients, they will end their 8 months of insurance in April, and then they will trigger a special enrollment plan for 60 days. If they don't enroll in marketplace coverage at that time, and granted they're not eligible for Medicaid, then they will be faced with the penalty. And so this is kind of like the map out of that. For the first 7 months, for the first 8 months, they have RMA, but at that 7-month line, they can start applying up until 10 months. But if you miss that 10-month line and you don't apply for ACA in time, then those clients will get penalized. And that can be a lot of money down the drain because of that. And they won't find out about it until tax time. Again, here are those penalties. So yeah, $325 per adult if we don't get them in that time. Say they come to you on the 63rd day and they want to apply for insurance. They can't do it. The special enrollment period has ended. So it's very, very important for anyone working with refugees, if they are ending that 8 months, if you are a VOLAG and you have clients who you know are nearing that 8-month end, it's very important that you refer them to someone so that they can go ahead and get this marketplace insurance. It's very easy to do. All they have to do is call this phone number. Actually, refugees, because they have arrived pretty recently, they usually they don't pass a credit check, and then also, of course, language access is a problem with the website. The website's not going to be in Karen or Nepali, but the phone line does have 150 languages, and we've had really good success using that language line. All they need is to have their pay stubs, their social security card, and their immigration documents. They can call on their own. Some clients, like our Iraqi clients who are kind of used to insurance systems and things like that, a lot of times I've had a lot of success with them calling on their own. But clients who are less familiar with systems, I would highly recommend sending them to a navigator or a certified application counselor. So navigators are available at every health center throughout the week. We're actually going to be sending out a list for open enrollment of when navigators are available. So if you have clients that you want to enroll, don't email me right afterwards. Just wait until the email goes out with all the sites of navigators, and you can refer there. But of course, I also recommend that resettlement sites get a certified application counselor. You can get certified as an application site fairly easily. You can do it online very quick, and you can actually do a training, and then you can enroll clients as well. And it gives you a little bit more context, and that's really great. So once they enroll, then they have a lot of options. They can pick between these bronze plans with 60% coverage, a gold plan with 80% coverage. They get to choose between PPOs and HMOs. They have to calculate what deductions and premiums, this premium versus that premium, or cost share reductions. There's a lot of jargon out there. And for our clients with limited education on these types of issues, it can be very, very overwhelming. And I highly recommend that any community-based organization or VOLAG, that you take the time to discuss these premiums, discuss what a copay is, really take the time, because again, this is the insurance that many clients will have for years from now. And if you don't teach it right, you can really kind of screw up the system there. Also, I think a great tip is to determine eligibility. Like I said, everything that I've just said about marketplace plans and special enrollment periods, all this scary stuff I've told you, is only applicable to people who are over 138% of the federal poverty line. So determining that eligibility is an important tool that if you are at a CBO or a VOLAG, you should be able to do, and it is very easy, I promise. And then, of course, ensure that clients are understanding that they can get penalized if they don't. Medical providers, I think that with these new plans comes new medication coverage, comes new costs, and with refugees for the first 8 months, you can kind of prescribe whatever you want. You can prescribe surgeries, you can prescribe them a million MRIs and CT scans, and Medicaid will most of the time cover it. But now we have this cost issue. So I would really tell medical providers that I think it's very important to kind of watch that and kind of make sure that you add cost and coverage to all conversations that you have about treatment with clients. And make sure to give patients options. A lot of times if you tell clients that they need to get an MRI, then they will shell out $100 to pay for that MRI, even if maybe there was a cheaper alternative. So make sure to give them options on that. So now we're going to go to Medicaid. So again, this is the other half. So if you're on RMA, again, I can only emphasize this a million times. If you're over 138% of the federal poverty line, you go on a marketplace plan. But if you're under 138% of the federal poverty line, which I would just guesstimate is like 70% of our clients, you'll stay on Medicaid. And most of you, again, are used to kind of this Medicaid we've had for 2014 where there's this huge gap. It only covers elderly or children or pregnant women, but that's expanding, right? So in 2014, it will expand up to 138% of the federal poverty line, regardless if you have some sort of disability, it doesn't matter. If you have kids, it doesn't matter. As long as you are under 138% of the federal poverty line, then you will be able to get Medicaid insurance. So what does this demographic look like? Again, this is families of 4 or larger. A lot of times you have, if they have 3 kids, if a family has 3 kids or more, they're almost definitely going to be on Medicaid. All those 3 kids, they push up the household income size, and then they push down the federal poverty line. So someone that can be making $28,000 with 3 kids will be under the federal poverty line, but someone with 1 kid making that same amount will be over the federal poverty line. So family size really does have a huge impact, especially for our clients who have really large families. Adults with grown children, so a lot of times I have a lot of clients who are like 50-something. They're not quite eligible for SSI benefits yet, but they're older and their kids are grown up, so now they're just a household size of 2. Sometimes they don't necessarily have a job and they're just taken care of by their kids. So those will also go on Medicaid. Seniors, of course, anyone who's over 65 will usually have SSI, which will allow them to have Medicaid. And then, of course, I want to emphasize that people who do have caregivers, so if you do have a Medicaid waiver and someone gets paid to be a caregiver for someone who's over 65, then they will actually go straight on that access card. They won't have an HMO anymore. They'll just use the straight access. Again, SSI beneficiaries, or anyone who has that employment authorization form signed for 1 year or more, those clients will stay on Medicaid as long as they're under 138% of the federal poverty line. Unemployed, of course, if you're at 0% of the federal poverty line, you'll get it, and then pregnant women will, of course, stay. And then, of course, kids. Most of this conversation is not about kids. This whole presentation isn't really about kids. Kids are pretty clear. They're usually always on Medicaid, especially in our populations. So now you probably are going to encounter sometime in the next 6 months, you're going to encounter clients who were not eligible for marketplace plans, but they fell in that gap, right? They fell in the gap that was in 2014. They were not eligible for marketplace plans or Medicaid. And now you need to know where to refer them to. So most of the time, right now, Medicaid is still up in the air. You know, the expansion is on the horizon, but it could go one of two ways depending on the elections coming up. But right now, we're just sticking to that if they're refugees, if they've come in the last 2 years, you can definitely send them to the welfare office. They still have a refugee case manager there if they've arrived in the past 2 years who can help them apply. But then online Compass applications are not that bad if you want to sit with the client and help them do the online application, or if they have someone in their family who speaks English, and that's a really easy way to do it. And then also somewhat new this year is there's going to be actually a phone line. It's questionable whether this phone line will actually have language access. That's something that we're still kind of waiting to hear back on. But that will be an option, especially as there's this rush starting in December for Medicaid. And I think that's important to note as well. For Medicaid starting in 2015, clients should apply in December. So if you have a client who fell in the gap, you can apply in December to start Medicaid on January 1st. But unlike marketplace plans where you can only enroll during either open enrollment or a special enrollment period, you can apply for Medicaid at any time. There is no enrollment period for that. Just really quickly, I kind of want to tell you about the two options that we're going with. I think if you're a refugee provider, you need to be able to kind of see these two different paths that we can go down. Again, both are the same when it comes to income level. Anyone who's under 138% of the federal poverty line will be eligible for Medicaid. But it's pretty, right now, if Tom Wolf is elected in the new election, then we're going to go with traditional federal Medicaid, which was originally proposed in the Affordable Care Act. That's basically just anyone who's under 138% of the federal poverty line will get Medicaid as it is now. So the same as refugee medical assistance for their first month, nothing will change. They'll stay on the same HMOs. You do not need to have a disability or have children. It'll just be a lot more comprehensive, but a lot of the same. However, if Corbett stays elected, he has put in place this Healthy Pennsylvania plan. It's a little bit more complicated. There are 3 categories that you can go into. You can go to Healthy, Healthy Plus, PCO. We're not going to get into a lot of that right now. Depending on what happens with the elections and depending on what happens with Medicaid expansion, we'll do later presentations about these different types and categories. There may be some premiums for people who are on the PCO plan. Those are people who are going to be newly eligible. So anyone who fell in the gap will go onto a PCO, and they may have to pay premiums starting in 2016, so not 2015. And then there's differences in benefits. Again, there's a lot of things that go into it. We're just not going to talk about it now. I just want to give you a clear image that depending on who is elected, you should be able to kind of keep an eye out and see what kind of happens with those plans. And then I just kind of want to finish out by talking about kind of 2015 insurance and RMA. Again, keep an eye out for what happens with Medicaid. This is going to be extremely important for, again, like 60–70% of our clients. What happens if Healthy PA does happen, and there's going to be a lot of there's going to be a technical side to that, and like what category people go onto, and there's going to be a lot of room for advocacy on the part of all behavioral health organizations, I mean community-based organizations and providers as well. So that's going to be big. Or if Medicaid expansion, I mean, there's going to be a lot of changes, and there's going to be a lot of kind of glitches in the system. So it's important to kind of keep an eye on that. And then in the greater scheme of things, changes to RMA. So other states around the United States who have expanded Medicaid have actually seen significant decreases in their refugee medical assistance. So states like Arizona, it went from 8 months of RMA to 3 months of RMA because after 3 months they would just enroll clients in Medicaid, and they would just stay on Medicaid until they were no longer eligible because of income. Which should work. Of course, there are glitches in the system, but eventually it did fix all the glitches, and clients are getting insurance now. But that's something to keep an eye out for. So as Medicaid expands, there will definitely be changes to RMA from ORR. Changes to marketplace plans. So every year, of course, the marketplace has private insurance, and these plans will change as the market changes. So prices will change, new plans will come onto the marketplace. They're always updating the healthcare.gov and the phone line. So keeping an eye on that. They are perfecting the system after last year's glitches. They are trying to make it a lot better, and they're doing a pretty good job. And then the last thing I want to say is appeals. So if you look at someone's income and you think they're eligible for Medicaid, or you think they're eligible for a marketplace plan and they get denied, always appeal. So if you're ever in any meeting with Community Legal Services, they will tell you to appeal anything that you are denied of. And it gives you a chance, even if you don't think there's grounds to appeal, it gives you a chance just to give some additional time. You can always reach out to Community Legal Services to do the appeal, or if you have any questions, you can definitely contact someone else through PRHC. So that's all I have for today. I know that was pretty long, but if anyone has any questions, then I can somehow figure out how to answer them by unmuting you. So I think if you raise your hand then on the little screen, then I can answer questions if anyone has any. Okay, it doesn't look like anyone is raising their hand. So thank you so much. Again, if you guys have any questions, feel free to give me a call or give Gretchen a call. And then, of course, we're going to send out more information about open enrollment and Medicaid expansion as it comes to us. And great, this will also be recorded. If you'd like to share it with someone else who you think would benefit from it, it'll be on our next PRHC email. All right, thank you so much, everyone.